For the past 4 decades, ACCC has convened oncology professionals from across the nation to discuss the latest trends and advancements to improve cancer care. Cancer Buzz is here in Austin, Texas this week for ACCC's 40th National Oncology Conference. We're bringing listeners along into the discussions from NOC. Right now we're here with Dr. Michael Gieske. He's a family medicine physician, and he's the director of lung cancer screening at St. Elizabeth Healthcare in Edgewood, Kentucky. Dr. Gieske is leading the Rural Appalachian Lung Cancer Screening Initiative, which is a joint effort with ACCC, Longevity, the Cancer Support Community, the go-to for lung cancer, and several state oncology societies. Tell us about the initiative, Dr. Gieske, and why is it needed?
Yeah, it's a really exciting initiative that we became involved in as an extension of the work I've done at the lung cancer screening program at St. Elizabeth. And we wanted to target a region in Appalachia where we know a lot of healthcare disparity exists. And we looked at the map and we found the area where the worst of all worlds come together. We have the worst mortality, the worst incidence for lung cancer, and the poorest access for services. And we targeted a 10-county pilot zone where Kentucky, West Virginia, and Virginia all come together. And that fit our model exactly. I mean, it's the worst of all worlds there. And we realized the challenges going in, but we also realized that we would be able to demonstrate, the most impact in that region.
You're a family medicine practitioner. Why is it so important to engage our primary care colleagues?
Well, the primary care docs, they're on the front line. We're the ones that have to deal with all the illnesses and health maintenance issues and the vaccines and breast cancer screening, colon cancer screening, and now lung cancer screening. And if you can't get the primary care docs involved, you're never going to get these screening initiatives to take off the ground. And it's really important to have the primary care docs involved at the outset to do the shared decision-making that's mandated by CMS, to talk about lung cancer screening, to spread the word, get the education out there, help defeat the stigma that's associated with lung cancer and the nihilism. And historically, lung cancer has been a death sentence. I've been in practice for over 36 years now. And over that 36-year period, I've seen a lot of lung cancer. I've seen a lot of families affected by lung cancer and patients, of course. And you hear lung cancer and it just gives you this horrible feeling in the pit of your stomach, but that's all changing now. The treatment for lung cancer has improved dramatically over the last 10 to 15 years. We got patients now that are 15, 20 years out with no evidence of disease that had late-stage lung cancer. And it's important to get that message out there that not only are we finding it earlier now, but even if we find it in the late stages, that you can make a tremendous difference.
Do you think what you learn as a result of this screening effort with the Alliance will be applicable to screening for other cancers?
Oh, sure. I think if we get a successful pilot in place for lung cancer screening, it's very easy to transport that knowledge and that experience to breast cancer screening, colon cancer screening, cervical cancer screening, you name it, and immunizations, HPV screening, and vaccines.
Will the Alliance share what you learn with the greater oncology community?
Oh, for sure. I mean, that's part of the overriding impact, really, of what we're doing here, that if we can establish in this pilot zone success, and I'm fully confident we will, that will be expanded throughout Appalachia and really throughout the country. Lung cancer screening still has a very low uptake in our country, 5.8%. And we know we can do better than that. At our institution, we have about a 47% uptake for lung cancer screening. And so I bring that experience, from St. Elizabeth Healthcare to the Alliance and to the ACCC initiative in rural Appalachia.
Thank you, Dr. Gieske.
My pleasure.
And thank you to our audience for following along with us this week from the ACCC 40th Annual National Oncology Conference. We'll be back later again today to share more discussions and learning sessions from the conference. Until then, I'm Summer Johnson.
This show is a resource of the Association of Community Cancer Centers.